The following video goes over the rehabilitation and restrictions after a total hip replacement using an anterior approach. Total hip precautions from an anterior approach include no extending your leg backward and no twisting, pivoting, or rotating your leg. Performing any of these motions may cause damage to the surgical site and should be avoided until you are cleared by your doctor. The following video goes over daily living activities to avoid after your hip replacement with the anterior approach.
If you have just undergone a total hip replacement with a direct anterior approach, here are some precautions you'll want to keep in mind. The first, no hip extension past neutral. The second, no twisting, pivoting, or rotating on that surgical side. These are some movements that you are going to want to keep in mind as you're going about your daily life. Here are some daily living examples that you'll want to keep in mind. Do not take huge steps with your non-operative leg, leaving your operated leg far behind. This then breaks the no hip extension precaution stated earlier. Do not wiggle your foot into your shoe. This breaks the no twisting, pivoting, and rotating precaution. Instead, use a long shoehorn. Do not cross your legs. Do not lean backward and or thrust your hips forward while scooting to the edge of your chair. This puts your hip in an extended position. Do not bridge your hips when laying in bed. Again, this puts your hip into extension, which is a motion you want to avoid. And lastly, do not get out of bed on your operated side. Instead, get out on your non-operative side.
As a recap, these are daily living activities to avoid. Do not get in and out of bed on your operated side. Do not take huge steps with your non-operative leg, leaving your operated leg behind. Do not lean backwards and or thrust your hips forward while scooting to the edge of a chair. Do not cross your legs, and do not bridge your hips when laying down. The bottom line, try to maintain the hip in a straight neutral alignment or flexion, but do not back into extension behind your body. Use tools to avoid these motions. Do not wiggle your foot into your shoe. Instead, use a long shoehorn to help put your shoes on easily. Exercises to perform following hip replacement surgery. These movements and exercises will help recover muscle strength and function in your legs following surgery. The following video is a home exercise program following hip replacement.
If you have just undergone a hip replacement, the following are some exercises that you can do at home to better improve your strength and range of motion in that new hip. The first one is ankle pumps. Move your foot up and down. Repeat 10 to 20 times every hour while you're awake. This is not only going to improve strength, but also circulation throughout the body. The second one is gluteal sets or buttock presses. This exercise can be done laying down, sitting, or standing. Squeeze the buttock muscles together and hold for 5 seconds. Relax and repeat 10 to 20 times every hour while you're awake. The next one are quad sets or knee squeezes. Laying on your back with your legs straight, push down the back of the knee against the bed. Maintain the muscle contraction in the thigh for 5 seconds. Relax and repeat 10 to 20 times every hour while you're awake. The next one is heel slides and lying. Bend your knee on your surgical leg and slide your heel towards your buttock, keeping your knee pointed up towards the ceiling. Repeat 2 to 3 sets of 10 repetitions twice daily. If this movement is too difficult for you to perform initially, you can use a towel or a pillowcase under your foot to help prevent friction, thus making it easier for the foot to slide. Again, you'll want to do 2 to 3 sets of 10 repetitions. Another option is for you to use a belt, wrap it around the top of the foot. You can then use your upper extremities to help pull that leg into flexion. Again, repeating 2 to 3 sets of 10 repetitions twice daily. The next one is a short arc quad. For this, you can either use a folded towel or a folded pillow. You'll want to place the folded pillow under your knee. Then, laying on your back, you'll want to fully extend your knee. Tighten the muscles on the top of your thigh and straighten your knee, keeping the back of your knee on the bolster. Hold your knee straight for 5 seconds and lower slowly. Repeat 2 to 3 sets of 10 repetitions twice daily. Lastly, the final exercise is the long arc quad, or knee extension in sitting. For this, you can either sit in a chair or at the edge of your bed. Raise your lower leg and straighten your knee until completely straight. Hold for 5 seconds, then slowly lower. Repeat and perform 2 to 3 sets of 10 repetitions twice daily.
Thank you for watching. For any questions or concerns, please contact your doctor or ask your physical therapist.